Hey, and welcome to TMI Tuesdays with Lauren and Di. We're your new favorite physios, and we're here to give you the down low on down there, destigmatizing pelvic health one episode at a time. Hey, welcome to our very first episode of TMI Tuesdays with Lauren and Di. I'm Lauren.
And I'm Di.
Today, we're going to chat a little bit about what the pelvic floor is, some signs, symptoms of when things might be going a little bit awry. We'll also start with getting to know a little bit about each of us, how we've met, our backgrounds, and just what you're going to be hearing from us every Tuesday moving forwards. So, Di, do you want to start it off with how we know each other, how we've met?
Yeah, for sure. So Lauren and I met in our undergraduate degrees at UBC. Lauren was a varsity rower and I was on the varsity soccer team. We were both doing degrees in kinesiology and we actually lived together for a year. Lauren then moved from Vancouver to Toronto to do her master's of physiotherapy. And I stayed in Vancouver for my physiotherapy degree a few years later. But we always stayed good friends and colleagues, and we were always there to bounce crazy physio stories off each other, ask each other questions, and eventually both ended up in pelvic floor physio.
Yeah, I know you fought it for a while, which I know you'll talk about next. Yeah, I definitely remember. I think we met each other maybe in first year. We were both in kinesiology together. I remember I knew who you were. You were a fit, cute, blonde varsity soccer player. And then when we moved in together, I remember being like, okay, this girl's so intense. She's just can fit so many things in a day. And I remember trying to keep up with you. I was like, I gotta keep up with Di. She would just whip together a loaf of bread 10 minutes before we head off to class. And we'd be in the gym at like 5 a.m. And I think a week into living together, I was like, okay, I cannot keep up with this girl. It's just too intense. But you would go, and then you'd crash for like 48 hours. I remember that cycle.
Yeah, I think things are a little bit more balanced now, but that definitely is my nature.
Yeah, definitely some fun stories that we'll maybe sprinkle in at the weeks moving forward.
So, Lauren, why don't you tell me a little bit about how you got into pelvic floor physio and what you're doing now?
Yes, thank you for that segue. So like I said, I did my undergrad in kinesiology, and then I went on and did my physio degree at University of Toronto. I did physio, I think, common story for most people, lots of injuries in my athletic endeavors. But to be honest, physio was kind of useless for me in university. I find chiro was a lot more helpful. I was a rower, so I had a lot of rib issues. But I think that inspired me. I was like, there's got to be more to physio than this. So I pursued it, hoping that I could be a better physio or give a better experience than maybe I had myself. So I graduated from University of Toronto and started practicing just in an orthopedic clinic, thinking that I'd be working mostly with the athletic population and just in sports in general. And I quickly got introduced to the pelvic floor world through a friend who was going through and taking some of the professional development courses. We don't really learn much about it in school at all.
No,
Did
not
you
at
learn
all.
much about it at UBC?
No, I think we had 1 or 2 days with a couple lectures, and it was a very big overview. I don't even think we really properly learned the anatomy.
Yeah, I think we just touched on anatomy, and I think we had a pregnancy section on pregnancy and exercise as well. It's a lot better now, but yeah, we had to take a lot of extra courses and get mentorship and things like that to really hone our skills that we have now. But really, our rehab backgrounds can be applied to this population and these issues. It's just kind of getting comfortable with a really vulnerable, intimate part of people's bodies, I think, which requires a unique honing of your skill set. But anyways, I got introduced to it through a friend and I was like, what is this world? I didn't think I'd really be into it. I had a lot of back and kind of hip issues through rowing and quickly learned that my pelvic floor was far too tense. Sort of surprise, just way too uptight, right? And learning to actually connect my pelvic floor and relax it was a game changer for me. And I found quickly that working in this area, you see big changes in people pretty quickly compared to, say, a typical shoulder rotator cuff or that kind of thing. And I found it
Yeah,
very rewarding.
I'd
Yeah.
say that we see people a lot less frequently and a lot less often to kind of get them to where they want to be or fix their issues than, say, a regular orthopedic patient for sure.
Yeah. Yeah. So how did you get into it, Di? Tell me a little bit about your story and what you're doing now.
Yeah, so I come from a family of physios. So I was always, there's lots of physios in my immediate and extended family. And so I've always been around physios. They were really sport physio focused. I came out of my undergrad degree and I did not want to follow in everyone's footsteps. So I actually did a couple years in kind of a sports marketing type job and really loved it, but learned really quickly that sitting at a desk all day was just not it for me. Eventually decided to go back and do my physio degree, and I'm so happy I did. I honestly can say that I love going to work every day. I know that's not something everyone can say, but even starting at 6 a.m. to see patients, I don't mind doing it. So I started out once I graduated as an orthopedic physio, and I actually did my Pilates certification when I finished school immediately, and we can talk about that another time. But I got into Pilates because I'd had a inguinal hernia myself, and during the rehab, I realized that Pilates was really beneficial. At the time, I also wish I'd looked into core and pelvic floor physio because I think that tied in a lot. But again, we can talk about that at a later date. So I did that to start, worked for a few years, realized that I was referring a lot of patients who became pregnant to pelvic floor physio and referring a lot of people with low back and hip pain to pelvic floor physio, and started asking Lauren specifically more and more about kind of what she or other pelvic floor physios might be doing with these patients, because they'd come back from seeing a pelvic floor physio and have amazing results. And then we could work on some of the other orthopedic things that were going on with them. And finally realized that really my practice was just missing a huge piece of the puzzle when I wasn't understanding pelvic floor physio and the pelvic floor and the core in a more in-depth way. So I eventually gave in and started to look into the professional development classes and did those. And so now I treat pelvic floor, sport and orthopedic patients still, and then still see Pilates patients. So I see like a wide variety of people of all ages and stages of life, which is amazing. I don't have to refer out for pelvic floor physio anymore for my patients. And I feel like I can really give comprehensive care. So I love kind of having that all together. I also get to work closely with some of the other allied health in our industry, and specifically in BC. So we work a lot with some of the top hip surgeons, the sports medicine physicians, and other allied health members, because everyone's starting to really realize the benefits of pelvic floor physio for men, women, non-binary people, and people of all ages and athletes and abilities. And so it's really exciting to kind of be on the forefront of this professional path. And yeah, it's awesome.
Yeah, you fought it for a while. Remember,
Fought it for a long time
yeah,
because we'll
this
talk
isn't for
about it.
me. This isn't for
No,
me.
we'll talk about it more probably in our next episode, but kind of what a pelvic floor exam is like. And that seemed really scary to me as a patient, let alone a practitioner. And so it took me a while to get beyond that. You kind of convinced me it wasn't so bad. And once I did the training, I was like, oh, this isn't bad at all. People shouldn't be afraid of it. It's totally normal and really comfortable. And I actually ended up teaching for some of our professional development courses. So you can see that I kind of did a 180 from when I started.
Yeah, once you get over the hump of, okay, you've got six of your classmates staring up at your vulva, then you're just good to go. You can face anything from there on,
Yeah,
right?
exactly. Exactly.
So where, for the audience if they're curious, where are you practicing now?
Yeah, so I'm one of the owners of Metrotown Orthopedic and Sport Physio, and so I practice there. I see people in clinic, and then I can see people virtually as well. I also own Elevate Women's Health, and I can see people virtually through there as well. How about you?
And that's, I just, for the audience who doesn't know, that's in Vancouver. So you're in
Yes.
Vancouver, BC, and I'm in Victoria. And Elevate, yeah, you do a lot of online programs as well through Elevate, right? You have some Pilates and kind of
Yeah.
returning things like that. Yeah,
Yeah, exactly.
awesome.
Yeah.
I'm in Victoria and I own Core Connection Mobile Physiotherapy. So we do all in-home. And I actually started the in-home by request in Toronto for the postpartum population. I was getting a lot of requests. It was hard to get out with a new baby. And I fell in love with the model of care. I found it a super unique way to practice and a lot more relaxed. And you can get to know people on a deeper level. And now we're sort of known for our pelvic health, but we work with lots of other populations as well who benefit from in-home physio, so seniors and people with significant mobility impairments.
Yeah. I think what you do is really awesome.
Thanks, Di. You too. Right back at you. So we'll move into our fun little next segment, which we're going to have on every week. It's called What the Fact. So it's a weird and wacky fact about the female body. Most of our podcasts, we're going to be talking specifically about female pelvic health, and we'll be referring to the female anatomy as women. But we will kind of chat and sprinkle in some men's facts as well, I think, as we move forward, depending on requests and popularity, I guess. Okay, so our first What the Fact segment is. So I brought it this week, and Di does not know what it is. I have not launched it on her yet. So that's our goal every week is we'll alternate. One of us will bring one and hope to not only shock the audience, but not really shock, but just give you some talking points. Maybe at, the water cooler at work, you can whip out these weird and wacky facts, or maybe at your next dinner with your in-laws. What do you think, Di?
I would be doing that, but I think it depends on your relationship with your family.
Totally. You can take it to another level, test the waters.
Yeah, definitely.
Okay, so today we are going to chat about the clitoris. So, Di, did you know, and to be honest, this one's probably not going to surprise you, but I thought we'd start here. Did you know that your clitoris is actually a mini penis? It has 8,000 nerve endings, which is actually 2,000 more than a penis. And what you see on the outside is actually only 10% of the entire structure of the clitoris. So it's about 9 to 12 centimeters long when you include all of it.
That's actually, if you think about that, that is huge.
Yeah.
9 to 12 centimeters? That's like this big.
Should we get a ruler
We should
up?
get a ruler. I don't have one here, but I'm pretty sure it's about this big.
Yeah. And yeah, the clitoris's only function is pleasure. So it has no reproductive function, no urinary, no hormonal role, unlike the penis, which is also responsible for peeing, boners, erections, the technical term, and ejaculation. So,
I
did you
mean,
know?
I
Did you
think
know all that, Di?
I did know that, but I think I'm cheating a little bit with my background. But
Yeah.
yeah, it's pretty amazing. And I think it's what's also interesting is that we can see people for issues when things go wrong around their clitoris. So I don't know if you've ever seen this. I'm sure you have, but sometimes I've seen nerve entrapment in that area. And so, especially with swelling pre and postpartum or pre and post abdominal surgery, sometimes the swelling can kind of cause some nerve entrapment in the area, and people get either desensitization, so less sensitivity, or increased sensitivity or pain. And I find something called fascial rolling or fascial release super helpful when that happens. But I think a lot of people didn't know that if they're having trouble reaching orgasm, or they're getting kind of discomfort or pain with girl touching, that it's something that we can help with.
Yeah. Yeah. We gotta free that.
Yeah, exactly.
Yeah, awesome. Well, you're up next week. I can't wait to see what you got for me next week. Got any
Yeah, I'll try
ideas?
to find, well, I'll keep them hidden for now, but I'm gonna try to find something that'll at least give you get a bit of a rise out of you.
I can't wait. Okay, we'll move into sort of our main topic for today, which is a little bit more about the pelvic floor. So, what is the pelvic floor? Signs and symptoms of when things might be not working quite optimally down there. And we'll share a few statistics with you, as well as how pelvic floor physio can help with some of these issues. So, let's get into the nitty-gritty. Di, can you share with the audience what the pelvic floor is and what are some signs and symptoms of a potential kind of dysfunction in that area?
Yeah, definitely. So your pelvic floor is a group of muscles that sit within your pelvis. They're often thought as a basket of muscles because they sit at the bottom of your pelvis, and they have a role in bladder and bowel function, peeing or constipation. They have a role in sexual function, reproduction, and they're closely related to your core muscles, including your abdominal muscles and your diaphragm, so that breathing muscle that sits at the bottom of your ribs, as well as your hips and low back. So people a lot of times think of pelvic floor dysfunction as just leaking pee, but there's a lot of other symptoms or things that pelvic floor dysfunction can feel like. So things that we see that people complain about or that pelvic floor dysfunction can feel like is constipation. So feeling like you can't have a smooth bowel movement, or it takes you a really long time to have a bowel movement. And you can also get urgent bowel urgency, so feeling like you have to run to the bathroom to go poop, and then maybe not having control of that. So whether that's having to do with pelvic floor issues or GI issues, that's something that we can look at because they're closely connected. Sometimes people complain of repetitive UTIs or bladder infections, and sometimes it's not. Sometimes it's actually pelvic floor dysfunction. And again, that's something that we'll kind of dive into later.
An overactive bladder, feeling like you need to pee all the
All the
time or
time.
always looking
Yeah,
for the next bathroom. Yeah.
definitely. Yeah, so there's the leaking pee, and then there's the feeling like you need to pee all the time or at specific times. Like for me, it's putting my key in the door when I'm close to home and I've got tons of groceries in my hands. That is the time that I get urgency or feeling like I need to pee right then. And that's pretty common, but it's something that we can help with. Sometimes people complain of pain or discomfort with intercourse or not able or pain for using tampons. And people can also feel like tampons or Diva cups are dropping out, and that can also feel like heaviness or feeling like something's falling out of their vagina at other times of their cycle as well. And so that's something we can help with. Numbness is something that we see a lot with cyclists. So kind of numbness in the perineum, kind of the area between, well, anywhere between your sit bones, your pubic bone, and your tailbone. Any numbness in that area is something that we can definitely help with, and we do see a lot with cyclists.
That's super common with male cyclists as
Yeah,
well.
totally. I've seen it a lot with triathletes as well and female cyclists lately. And I
Hmm.
think yeah, we won't get into it, but there's some reasons why that might be kind of cropping up more. We can talk about that again at another time. But it is interesting to see kind of those changes over time and kind of what comes into our clinic, definitely. People can also come in with pelvic floor dysfunction, and it can feel like hip or low back pain or hip and groin pain. So sometimes people will have, or so maybe they've had an MRA and they've seen a surgeon, they've been told they have a labral tear. They often can also have pelvic floor dysfunction at the same time, or maybe that's what they think they have, but there's nothing on imaging. That's something that we see. And then lower back pain and discomfort, including sciatica, is something that we often see as a symptom of pelvic floor dysfunction as well.
Those last few were mine when I first got into it, was the hip and the ongoing back. So learning about my pelvic floor really was a game changer for me.
Yeah, definitely. It's pretty remarkable how quickly things can change too once you kind of start treating the root cause of the issue.
Hmm. Yeah,
Yeah,
a whole new world for a lot of people.
yeah, definitely.
All right, moving into a few quick stats about pelvic floor dysfunction. So the average woman waits years to seek help with pelvic floor symptoms, which is, I mean, I don't have a specific there, but that's, I mean, based on what we see, not surprising, but also shocking probably for a lot. What do you think?
Yeah, I'd say clinically, I see both males and females. It's really interesting. So I find that women tend to, when I ask them how long this has been going on, and they will usually say a couple of years, like it's usually at least 6 months, but it's usually a couple of years. And they've maybe seen other healthcare providers, maybe not. Might have been something that they're too nervous to or embarrassed to talk about. So that's something that can be a bit of a hindrance on why people seek help. But it's really interesting because I find that men, when they come in to see me, whatever the issue is, has been going on for maybe a month or two. And so they're coming in to see me immediately because they know that when things aren't working right for them, it's important for them to get it fixed, and they kind of will do whatever it takes to do that. And so I think it's societally really interesting just to see that juxtaposition between men and women, and we're hoping to change that. Like I'd like to see women know that there's something that they can do to fix their pelvic floor issues, and they don't have to wait years and years.
Yeah, I think it's improving, but I think culturally, like our parents' generation, it was just a normal part of having a baby, right? Or a normal part of going through menopause. And so I think the education is really improving that no, it's common, but it's not normal. And if you address it sooner rather than later, usually your outcomes are a little bit better. But it's also never too late to address it as
I
well.
think it's really, and we're going to do an episode on menopause, but I think it's really interesting. Have you noticed more patients coming in talking to you about menopause symptoms recently? I feel like the education and the awareness and the people's ability to talk about it within their friend groups even has increased in the last maybe 5 years. And the research has also caught up to that. So there's more evidence backing it up. And it's really exciting to see people coming in and not waiting anymore to talk about menopause symptoms.
Yeah, that's actually one of the questions from the audience that we
Oh,
got is
okay.
about menopause and TikTok. So we'll share that
Okay.
a little bit later
See,
today.
TikTok can be helpful, maybe.
Okay. Yeah. Okay, so next stat, 1 in 3 women will experience some form of pelvic floor dysfunction in their lifetime. So that's quite high.
Definitely. Well, I think that if you think about both of us, we both have experienced it. So we're 2 for 2.
Yeah, there you go. And over 50% of women over age 55 have at least one pelvic floor dysfunction. And so that just speaks to the prevalence increasing as we get older as well.
Definitely.
50% of women who give birth vaginally have some form of pelvic organ prolapse on exam. And so we have an episode coming up on prolapse, which we'll dive into all of that and the symptoms and exams, all of that. And then 1 in 5 women struggle with chronic pelvic pain. And I think this actually is probably underreported. I think, it's very, very common endometriosis, especially in teenage girls. And I think often, yeah, it kind of gets, brushed off, or often a lot of them will go on birth control and then their symptoms are masked for quite a long time. So I think that's probably higher. What do you think?
Yeah, definitely. And I think it's important. So chronic pelvic pain means pain longer than 3 months.
Hmm.
And I would say a lot of people that come in with that would be with pelvic pain would say that they've had it longer than 3 months. And I just also think that a lot of people aren't coming in to get treatment. So I totally agree. I don't know what the actual statistic would be, but I think it's probably more than 1 in 5.
Hmm. Yeah, yeah, I agree for sure. Yeah, so pelvic floor physio, we can help to address all of these issues. And in our next episode, we're going to chat more about what your first session looks like. But essentially, we have background in the anatomy, how the muscles, the joints, the ligaments all function together. And so we apply this physio training to this specific area. So these are muscles just like muscles everywhere else in our body. They can become tense, painful, they can become weak, they can become tense and weak, and they could also have poor coordination. So they're not working well together with the rest of the system. And so we're looking at, what's going on with you specifically, because you can have the exact same symptoms as someone else for very different reasons. So we want to do an individualized assessment of not only the pelvic floor, but also externally, your core muscles, your breathing, your spinal mobility. So we're looking at things, posture from head to toe.
I think
And
that's
then,
important to note because we'll talk about it more next episode about what pelvic floor physios do. But if you see someone who's not a pelvic floor physio, you can have the same symptoms of somebody else. But if they can't feel internally what's going on with those muscles or visualize what's going on with those muscles from an exam, then they don't really know. We don't have the whole story. And so someone might be giving you treatment or an exercise prescription that is actually the opposite of what you need. So I think what Lauren said about making sure it's an individual assessment is so important.
mhm, yeah, for sure. And then, yeah, we prescribe sort of a treatment plan for you based on your specific assessment and what we found. So it's a lot of education, teaching you how to use this part of your body better. I always tell my clients it's more mentally challenging than physically challenging, because you're really trying to just connect and understand. There may be some hands-on treatment, depending on what the issue is and what you need to kind of release some tension in that area or other areas. But again, it's a lot of education and exercise and basic things you can kind of integrate into your day-to-day life.
Yeah, definitely. I think we try to make it something that you can do in your day-to-day life without taking up too much time or overhauling your whole life too.
Yeah,
Yeah.
yeah. Simple. Simple is
Yeah.
better.
And we'll talk about it next time, but it's not just Kegels. So it's way more than that. That's what it kind of used to be. And we've gone way beyond that. So if you think you're just going to get Kegel exercises from a pelvic floor physio, think again.
Yeah, that's not even scratching the surface.
Yeah. Yeah.
All right. So why don't we move into answering some questions from the audience? Already have a bunch. We won't have time to answer all of them. I think we said we'll answer maybe two, maybe three today, but we'll save them. Our goal is to answer all of your questions. We love questions. Please write in, send us a DM on Instagram. We'll make an effort to post something a couple days before we record each episode so that we can get some new ones. But if you don't hear your answers today, don't worry. We will address them in future.
So, what is all this TikTok talk about the labia disappearing in menopause about?
I'm not on TikTok, but
Oh, you're missing out. I don't know if you're missing out on the good and the bad, I guess.
am I missing
Yeah,
out?
you are.
I can't do another app. It's too much. But
Fair.
yes, so I see what they're asking. And so with as we approach menopause, our estrogen starts to decline. And so this drop in estrogen, what it contributes to is the fancy term is genitourinary syndrome of menopause, or GSM. It used to be called vaginal atrophy, but I think they're getting away from that term because it's a little bit disheartening and intense.
And scary.
Yeah, my
Like, where is it
vaginal
gonna go?
atrophying. Yeah. So we try
Exactly.
not to use that term anymore, but just wanted to share that, it's still getting tossed around out there. So what we see happen is the tissue integrity starts to change. So we start to see thinning and weakening of the tissues. We start to see a loss of bulk and muscle mass in the labia and in the surrounding area. So the labia do start to thin. They lose elasticity as well, and some of the fat deposits in that area. So I wouldn't say they disappear, but they do start to change in function and shape and structure. We also get a reduction in blood flow and moisture, which can make these tissues more fragile and more prone to irritation. And often there's other symptoms as well, like increase in urinary incontinence and potentially prolapse. But again, we'll talk about that. We'll do a whole episode on menopause. But these specific tissue changes are usually treated with topical estrogen and potentially systemic estrogen, depending on what other symptoms are going on related to menopause. And then pelvic floor physio can help as well in combination.
Yeah. No, I think that's really helpful. And if that's something that you're experiencing or you're worried about, I think it's important to see your gynecologist and then also pelvic floor physio for sure.
Yeah. Yeah. Okay. Di, I heard that Botox. I heard about Botox in your pelvic floor. Is that really a thing?
Yeah, it is. So Botox is botulism toxin, and it's often used in the face to freeze muscles. And it's kind of similarly used in the pelvic floor. So it's not something that physios can do, but a lot of gynecologists can do it, or urologists also do it. And someone that might get Botox in their pelvic floor is someone with pelvic floor dysfunction where their bladder is hyperactive. So when it's going into spasm all the time and maybe they're not able to fully empty their bladder, that's someone who might get Botox for their pelvic floor. And someone that has constipation, so chronic constipation and everything else isn't working. We've tried a lot of conservative treatment. Botox can help with that. I don't see that as common, but it is something that is an option. It can
I haven't
also,
seen that actually.
yeah,
Interesting.
it is
Yeah.
something that I've heard of, but I haven't actually seen it in my practice either. It can also help with things like chronic pelvic pain. So if someone is getting spasms due to things like endometriosis or IC, interstitial cystitis, or other chronic pain syndromes where the muscles are just spasming and we just can't get them to relax, despite everything that we've tried, then Botox is a good option for that as well. And it can be used for myofascial pain where, again, muscles around the pelvic floor are going tight and kind of causing painful knots and spasms and making the nerves irritated. So sometimes Botox to relax the muscles in that area is an option. And often, if that sounds scary, needles in that area, which it sounds scary to most people, then just be assured that they'll usually use lidocaine as well so that they'll freeze the area first. And then it doesn't last forever. So it does wear off. Sometimes people get it multiple times, so it might have to be done a couple times a year. Other people find that once they get it once is so effective that it gives them a bit of an opportunity to make those changes lifestyle wise or with pelvic floor physio, and then they can maintain it. So just because you've had it once doesn't mean you always have to get it. Everyone's a little bit different. It has to be tailored to you, but it is something that is a treatment option.
Yeah,
But
I've
you wouldn't want to see a dermatologist for it.
no, yes,
You're
dermatologist.
going to a different doctor for this.
Yeah, if your dermatologist is recommending it for your pelvic floor, I might opt out. I might recommend
Yeah,
opting out and seeing another
yeah,
specialty.
definitely.
Yeah. Yeah, I've seen it in the neurological population as well because spastic bladder is very common in MS and Parkinson's, and it can be quite effective to help I kind of describe it as like turning the dial down on the intensity
Yeah,
of that
definitely.
urgency and frequency for the
Yeah,
bladder.
yeah.
Awesome.
Okay, I think that's going to wrap it up for today. So, Lauren, is there anything else you wanted to add?
No, I'm just stoked on this, and I hope everyone else is as well. Yeah, excited to chat with you. We're hanging out early Tuesday morning in our sweats, and hope you guys get as much out of this as we hope. And yeah, please write in, ask questions, and we just want to have fun. We just want to have fun with this.
Yeah. So, whether your pelvic floor is tight, tired, traumatized, or just a little confused, we're here for it.
Thanks for listening to TMI Tuesdays with Lauren and Di. We're your go-to gals for the real goss on all things vaginas, butts, and more. Follow, share with your group chat, and leave us a rating so we can spread the pelvic gossip. Got a topic you want us to cover? DM us on Instagram. We'll see you next Tuesday. Keep it tight.
But not too tight.
Thanks for tuning in to TMI Tuesdays with Lauren and Di. We hope you laughed, learned, and didn't clench too hard. Please subscribe and share with your gals or guys who may need some pelvic floor love. We can't wait to hang with you again next Tuesday.